Hello.
Hello.
All right, I think we should start with the basics. Do you think you could give us a definition of urban sprawl and maybe an example or two of a place that has a lot of sprawl versus a little sprawl?
Absolutely. Imagine you are living in the city of Boston, Manhattan, or in San Francisco. You get off your house, you leave your house, and you have dozens of destinations to go. You can walk everywhere. You can go to a restaurant, socialize with people, have an enjoyable, nice walking or biking, go to a coffee shop. 10 or 15 minutes walk and you are in a train station and you can go to your job. You are well connected to everyone and everything. And that's what most developed countries are building, how they are building their cities and neighborhoods. On the other side of the spectrum, a suburban typical neighborhood in the US, which most of us have lived and have experienced. You are living in a place that has nothing but single family detached, no other destinations, no other uses, all cul-de-sac roads, no opportunities for walking and biking. You have no choice but to drive everywhere, drive long distances, drive frequently, and being in congestion all the time. And that's what is the typical definition of sprawl, and that's what the US built environment and cities are mostly have been dominated by. And you see a huge difference in these two types of development and their health and quality of life outcomes.
Yeah, so I wanted to ask about that. You had also briefly mentioned like the 10 to 15 minutes. I'm sure people have heard this buzz term of 15-minute cities. I mean, it's part of the culture wars. And so when you're thinking about health outcomes on this spectrum of little sprawl to lot sprawl, is one considered healthier? Or what are the ways in which you're measuring and tracking that, and what could be done to address it?
Great question, Zahra. In suburban areas, as I mentioned, you have to drive everywhere. And that means less opportunities for walking, biking, and physical activity, more likelihood of obesity, which is like what 43% of American adults are dealing with. And all the chronic diseases that are coming with that, like high blood pressure, diabetes, cancer, heart disease, coronary heart disease. And that's not because we don't want to be active. It's just we don't have neighborhoods that help us to be active. Long driving and frequent driving means more likelihood of crashes, and higher speed of driving means more likelihood of being in a severe and fatal crash. 3.5 times higher likelihood of being in a fatal crash in sprawling areas. And if you look at the crashes, it's a leading cause of death for people aged 15 to 65. Less access to opportunities, healthy food, more likelihood of being located in a food desert, also mental health. More driving means more isolation. You kind of trapped in your neighborhoods, not really much opportunities for socializing, and more likelihood of depression. It's not only about our health, but also our environment. More driving means higher rates of greenhouse gas emissions, hotter summers, and more frequent extreme weather events, and all of that means more health-related, heat-related health outcomes. If you combine all of this together, living in a more compact or more sprawling neighborhood means on average about 3.5 years of difference in life expectancy, which is huge, because according to CDC, if there were a cure for cancer, the improvement in life expectancy would have been about 3 years. And we can do that through changing our neighborhoods and cities. The second part of your question, Zahra, how we can do it? Through zoning reform. We should stop zoning and building exclusionary, only single family detached. I don't know if you know, but our cities won't allow other types of development in neighborhoods. And that has been, you've heard about not in my backyard, kind of causes that is associated with that. We have to change that. We have to go through zoning reforms and create neighborhoods that are inclusionary, that allow us to build everything connected, people next to each other, people next to destinations. And we have good examples of that, like Minneapolis or Tacoma in Washington, which one of our fellows actually have been helping with their zoning reform, Judy Alston.
And I know that Judy and you are going to be available to kind of talk about this stuff more. I really appreciate you taking the time, and please, thank you, everyone. And you can find our experts out in the hall if you want to ask more questions. Thank you.